Hey, I'm Mark Kovacs. I'm going to be talking today on tennis injury and physiological load management. So, when we're talking about tennis injuries, there's a lot of research, and the challenge we have with tennis research is there's a lot of different cohorts of players. You have junior players, you have high school level players, you have collegiate players, professional players, adult players, seniors, and then even super seniors. And super seniors could be above 70, 75 years old. So we've got this large group of the population from cradle to grave, really. It's one of the few sports in the world that it actually allows for research across all segments of population, which is great, but it also means tennis research studies are limited because most of them are focused on a certain cohort. So the more competitive players are typically what I've had the privilege and history of working in, and they've got a very different injury profile than a adult recreational player who may play once a week or once every few weeks with friends. So we have to be careful about how we interpret tennis research data. So in general, though, lower body issues are a little bit more prevalent than upper body across all segments. Upper body becomes more of an issue, especially as individuals age and if they have bad technique. High volume and poor technique are the two major predictors of tennis injury. So we have to understand both aspects, the volume piece as well as the biomechanical aspects of stroke and movement technique. There are a lot of varieties of injuries in tennis athletes. We have things like a calf injury, which we usually see in the adult and the senior players much more than the junior player. Whereas in the, for example, tennis elbow is much more of a injury in individuals that have poor technique. It's surprising, but in the professional game, you'd never see tennis elbow. The best players in the world don't get tennis elbow. They'll get golfer's elbow, so they'll get more, from that perspective, they'll get a lot more medial elbow problems, but they won't get lateral elbow issues. So we see the lateral elbow issue in typically the recreational player, an individual that doesn't have very good technique. So if you're working with tennis players and most of them have lateral elbow pain, many times that's a coaching issue, and that is something that needs to potentially be addressed. Competition calendar congestion. So this is more for the high competitive player. Accumulation of matches in a short period of time. Just like any other sport, tennis is prone to accumulating a large number of matches in a short amount of time, which can be really problematic. And there's been some good research by multiple groups, and I've been involved in a few of these studies. Dr. Jayanthi and the tennis medicine group at Emory University does a phenomenal job with some of this research, and it's just looking at how does volume impact injury rates. Competition congestion in juniors does lead to greater number of injuries. You can always ask the question as to why. Is it purely volume? Is it other factors? Fatigue, of course, plays a major role in all this, and that's one of the biggest reasons. Medical withdrawals increased by 50% if players participated in greater than or equal to 5 matches in a single tournament. And a lot of factors go into that. A lot of times, 5 matches in a tournament, that's over 3 to 4, sometimes 5 days. A lot of that may be late in an event. A parent may want to leave. A child may want to leave because they have to kind of get back for school or other factors. So there are some of those scenarios, but it's still a major, major issue having a 50% withdrawal rate if players participate. Increased by 50% compared to if they play less matches in greater than or equal to 5 matches in a tournament. External load in the junior player. So, anyone that plays more than 5 hours a week, we consider a competitive tennis player. And they do see a greater chance of injury, just like any sport. If you play a certain number of hours more than someone else, your exposure goes up. And with greater exposure, injury risk also goes up. But we also need to understand that they need to get a certain dosage of training to be able to adapt to the demands of competition. So if you're going to play competition, you need to train usually more than 5 hours a week to handle weekend competitions or tournament competitions. So you have to interpret this data, not just saying play less than 5 hours and you won't get injured, which is likely true. If you play less than 5 hours a week, you're probably not going to get as many injuries as someone that plays more. But you're also not going to be very competitive if you have to play 3, 4, 5 matches on a weekend. You're likely to have a spike in injuries due to the lack of preparation. So there's some factors there. So here is a situation here where we're looking at serve volume as a predictor of injury. Dr. Natalie Myers out of Texas State has done some really interesting work. She worked with Dr. Ben Kibler at Lexington Clinic for a number of years, and where she started some of this research under his guidance, and we worked together on some of these projects over the last probably 5 to 6 years. And this was trying to somewhat mimic what was done in baseball decade and a half, 2 decades ago with pitch counts, and trying to come up with, was there certain correlations regarding increasing serve number and the increase in injury. And there was some relationships over the course of a season. So if you served over 2,000 serves, you're at a higher risk of upper limb injury, but it was a predictor. So partly the data set wasn't robust enough to make definitive conclusions here, but also we have to be a little careful because there's factors regarding in practice serves versus max serves, and also this really didn't take into account the types of serves: spin serves, flat serves, slice serves, things like that. So this was a great first study that allowed us to sort of open the discussion, but a lot more information and research is still needed to get at exact numbers. And just like all sports, there's a big divergence of what athletes can handle based on genetics, based on training history, based on serve speed as well. So there's a lot of factors that do go into this. So let's get into some practical application aspects. So if we're talking about the tennis player, this is a pretty typical visual of a tennis player. This was a high-level junior, played at a top 10 D1 collegiate program, and is playing professionally now. So this is an example of typically what we see with a competitive tennis player. We can see, if any of you are looking at these visuals, you can easily see that the right arm does not straighten as well as the left. We have that bend in the elbow, and then we also see a difference in internal shoulder range of motion. So the lower hand on the right, so if you ever look here, we've got situations here where the right arm, so that's looking at internal rotation of the shoulder here, has a bigger restriction. Notice the winging of the scapula in that position as well. Whereas look at the left side. We've got a nice shoulder blade, no excessive movement. We've got greater internal range of motion on the left side. So you can kind of see the difference between the right-handed player here versus the non-dominant arm. And as we know, that's not ideal, but it is something we see a lot in high-level competitive tennis players that typically train between 15 and 25 hours a week hitting tennis balls. That adaptation, which we're trying to overcome by off-court training, appropriate shoulder, prehab, things like that. So if you want to get more information, email me. I'm happy to send you a bunch of studies on this. This is some work I did with Todd Allenbecker, and we worked on a number of studies and reviews on the tennis serve, specifically for understanding the mechanics of it, but also then developing appropriate training programs for it. And here's just one example for the folks that may not be that familiar with what we want to see versus not want to see. This is an example of a good player, but they have some obvious biomechanical adjustments that are needed. Biggest thing here is typically what we want to see is the orange line, that nice 45-degree angle. That's ideal. That's what we see in all great servers. The one thing this athlete doesn't do very well, though, is look at the hip angle, the hip position. The hip position here is basically straight. The orange line here is straight. That should be identical to the shoulder angle. So all the great servers usually use their back leg better, and they'll get that hip position to be back and down a little bit more. So upper body mechanics look good. Lower body mechanics have some work to do. And you'll see on the next frame what this results in. We can all see, even if we don't know tennis that well, this position of the lumbar spine is not ideal. We've got significant curvature here during the motion. And that's not something that we want to see, because one of the major issues we see in junior tennis players is stress reactions and pars fractures, especially L4, L5, and S1. So it's either L4 and L5, L5, S1. It's usually somewhere in those two locations, or in both locations sometimes. And a lot of it has to do with this position here. And then they come out of that position violently, where they're over rotating and they're flexing excessively. And as we know, that's not really the way the spine wants to move. And unfortunately, a lot of players get into this position, which is not the correct position to be in. And as a result, take a look at spinal position here. You can kind of see that excessive spinal position, and just look at the spine and the movement to the left here. And then look at the arm. This arm is what we call Statue of Liberty, where the arm's straight above the head. That's not the ideal angle. The yellow line angle is the preferred position of the arm, and that's normally at about 120 to 125 degrees of abduction. As you can see here, we've got the purple line is closer to 160 abduction, so 170 even, and that's problematic for a number of reasons. So a lot of an athlete like this will potentially have shoulder or elbow or lower back related problems, and it's not usually a volume issue. It's usually a mechanics issue. So we have to address that appropriately. So again, this is typically how we go through the assessment and evaluation. We understand the serve mechanics, the 8 stages, and we work with figuring out where in the motion are there those limitations. And again, if you're interested in going into way more depth with that, please email me and I'll send you a bunch more information around that. So let's shift gears a little bit and let's talk about physiological load management specifically for the sport of tennis. So we're all familiar with what happens when athletes train. We get this shock and alarm stage where there's a stimulus that's being applied above and beyond what the athlete can normally handle. So we're looking for adaptation. So we're trying to get that shock and alarm stage. Then we usually get into some form of overreaching and or resistance. We hopefully don't get into this chronic stress or overtraining for too long, meaning that if we're in there for a few days and the athlete feels it, the coach sees it, the trainer sees it, and you're able to adjust and deload. And then hopefully you get enough recovery time that you hit into stage 4, which is that super compensation and recovery stage. And that's the ideal sort of training scenario for most athletes. We push them hard enough that we get this overreaching, we get even a day or two into some form of chronic stress where they understand that they're getting there, and then we pull back appropriately before we see any of the real negative ramifications from excessively staying in stage 3. We want to be in stage 4, ideally, as much as we can. But to get to stage 4, we have to go through stages 1 through 3. And this is where most people mess it up. Well-meaning coaches, parents, trainers, therapists wants to push an athlete, and we either over-push them, which we're seeing less and less of now for a number of reasons. One is a lot of coaches haven't trained under coaches that have developed great players, so they don't always know what hard work even looks like and where the body can go. 2, we've got a liability culture, so people are scared to push athletes due to a number of reasons. We're seeing that in college athletic departments more than anywhere now, is they're just backing off and they're doing way less. So our athletes are getting undertrained, but they're still being asked to compete at the same high level. And that's the biggest concern is we're starting to see over the last probably 3 to 5 years a decrease in training volume, a decrease in training intensity, yet trying to maintain the same competitive environment. So the individuals that are doing that, they feel better when they're training because they're in, they're more comfortable. Their readiness scores, if they're using any types of technology, are saying, "Hey, you're ready to train today." That's great, and there's a lot of important aspects to that. The problem is if they don't get enough training and enough volume, they don't build up resiliency. So it's really, really important to understand that. I was talking with some coaches this week actually, and we were talking about Emil Zatopek. For the folks that aren't familiar, one of the best runners of all time back in the 50s, and training habits were absurd compared to what we would consider today. Literally go out and run 40 or 50 400-meter repeats. And he would do things that today would be considered, not even humanly possible for most people, but that was how he trained. And not saying it was the right way to train, it was more the concept of what the human body can handle and what the human body can train up to if it's progressed appropriately and if the athlete has the right genes. So we need to make sure that we take those things into account. So the purpose of that was to kind of show the next aspect, which is how do we use various monitoring techniques to be able to understand how hard we can push our athletes without taking them over the edge. So there's 4 broad categories. We have the internal objective group, which is a lot of where technology is going. It's trying to get at, can we get inside the body and look at heart rate variability, look at glucose and glycogen levels in real time, look at lactate, look at O2 levels, things like that. That's internal and objective. The athlete can't fake it. It's an objective score coming from a device that we hope has good validity and reliability. Internal subjective, they're your surveys. You ask your athlete, how you feeling? RPE, rating of perceived exertion, is the most likely that most people use. 1 to 10 scale, how do you feel? It's come from the original Borg scale, which was a 6 to 20 scale, but most people now use a 1 to 10 scale. Most athletes understand that a little bit better. External objective, this is where you see GPS play a role, velocity-based training, accelerometers, things like that, power outputs, and there's a lot more technologies popping up in this space as well. And this is very useful because it provides an external objective metric, but it also has serious limitations. And too many people are trying to make broad-scale analysis from a single variable, which is really dangerous. We know how complex the human body is. We can't make our decisions based on one variable. It's a piece of a puzzle, but we don't have the other pieces of the puzzle. So we need pieces from all 4 of these areas. The 4th one is external subjective. And this is one of the most important. This is one that probably gets used, but it gets used in such a subjective way that it's potentially biased to the point of being difficult to understand the accuracy of it. Meaning that if we're using assessments for coaches and parents and trainers, therapists, physicians, clinicians, whoever else is around the athlete, we want to have some way to standardize that and feel confident that we're getting good quality information from that athlete, from those people around the athlete. So making sure we get a piece of the puzzle, knowing that a lot of you may not have access to the athletes more than the clinic hours you may see them in, you probably don't get a lot of access to all these factors. But are there things that you can work with the coach on to try to get a better picture of what the athlete's doing and what the load is on the athlete? And these 4 areas, internal objective, internal subjective, external objective, and external subjective, have to be in a program for an athlete if it's going to be working with competitive athletes that are looking to play at a high level. So again, here are some of the many things that we try to assess, and the list goes on, but these are just some that can provide value and meaning, and most of these are relatively easy to get. Some of them are subjective, some of them are objective, some of them are invasive, and some of them are not. So it depends on the athlete, where you work, how much access you have to technologies as to what you will use. Let's use heart rate, for example. Most people these days have enough access to heart rate monitors to provide some value. Understanding that if we're using an Apple Watch or a wrist-worn heart rate monitor, we have some inaccuracies in the data. I think most people nowadays understand that it's not bad for general daily activity to get a sense, but for athletic performance and accurate heart rate metrics, the chest strap is still the most valuable. This is an example here of um, two kind of tennis workouts. Actually, one is a tennis workout, which is the black line, the black thick line, and the other is a traditional sort of endurance run. So you're running for 60 minutes. And both of these averaged a heart rate of 160. The tennis match, had peaks about 190 and valleys about 110, whereas the endurance or the 60-minute run at approximately 160 beats a minute didn't really go below 150 and didn't really go above 165. So that was where the variation is. So we have to understand that training for tennis is very different than just going out and running for 60 minutes. Even though their average heart rate was the same, how they achieved that was significantly different and very, very important when we're designing training programs for tennis athletes. So here's a 100-minute, well-structured practice session, which was a very tennis-specific focused session. This was with an RPE of 9, so rating of perceived exertion of 9, and for a top 50, this was a male ATP player. So again, the way this was designed was trying to hit around 180 many times throughout the session. As they got more fatigued, brought the peak down a little bit so that they could maintain quality of work without the heart rate getting too high. But then there would be more recovery sessions or more recovery time put into the program towards the end. So again, this is a program that was well thought out, well designed, something we used a lot with players because we had access to heart rate monitors and we understood what we were trying to accomplish based on how the players' matches were as well. So here's another session. Again, same concept. These were various hitting drills from on the tennis court, trying to develop tennis endurance, because when we're talking load management, the whole purpose of load management is not only for games, because in the tennis space, you can't pull an athlete or sit them on the bench for 5 minutes or put a minutes restriction on them that you can do in other sports. They have to finish the match. They're out there. So you don't have a luxury of adjusting what happens during matches. What you do have the luxury of is training them so they can handle potentially the hardest possible match that they may play. That's where the load management comes in, and the training very, very hard during those practice days to allow for that. So, fatigue makes us cowards of us all. That's the statement we hear a lot, and to a certain extent it does. But this was a great study by a biomechanist out of France, Dr. Martin, and she actually looked at the influence of prolonged tennis match play on biomechanics. And do we see a decrease in biomechanics? So in her study, and this has been repeated in a lab I was in as well, we looked at this as well with some players, and we found a similar result. And that result was that we really didn't see this huge decrease in or change in biomechanics after 3 hours of tennis play. We saw some adjustments. We saw some shifting in how the body would recruit certain muscles, but we didn't see a clear breakdown in technique. There was this decrease over time, but it was not something that was so significant that you were like the mechanics completely broke down. And, the reason being is, the tennis players are adaptable. They have the ability to adjust, and they have the ability to shift various components of the body to make contact with the ball. Great athletes are adaptable, and they usually find a way to achieve their result. So I'm going to finish up with a few slides on this concept of returning to tennis. So this could be post-injury. A lot of this could apply to after breaks. If players take months off, how do you bring them back safely and successfully? And this was using real data from professional players. And the goal here, as you can read, is to focus on real data to show how to prepare for return to tennis scenarios using previous match data and training data. So we were able, in a previous life when I was working with US Tennis, to measure a lot of stuff with players, having coaches monitor sessions. And tennis is difficult because you don't have the same technologies that are available to soccer, basketball, football. You don't have the same ability to set up camera systems because tennis players play at different clubs every week and they train on even different courts from day to day. So it's very, very difficult to get high-tech technology monitoring an athlete every day in real-life situations. So typically what we use is simple metrics. RPE, rating of perceived exertion, and session duration, so time. So a 2-hour session is 120 minutes. You multiply that by the RPE. Let's say it's a 10, hardest session they've ever done. That would be a 1200 on the scale of workload. So a really simple way that anyone with no resources can still monitor a tennis player. Most of you are familiar with RPE scales. This was the terminology, though, to go along with it specifically for tennis. So very similar between on and off court. 5 is average, 6 is above average, 8 is hard training. So very similar to most RPE scales, but this was the language associated with it. So everyone, coaches, strength coaches, were on the same page with this. And then here are some of the results. So as you can see, overall average for a daily workout, weekly workload, training week averages, training tournament weeks. How do they differ from training weeks? As you can see, most weekly workloads are higher in tennis players than their tournament weeks. Most players lose in tournament weeks. Could be match 1, match 2, match 3, match 4, but they usually don't play as consistently in a tournament as they do in training weeks. Highest workloads, you can see from a training week, what we see in a training week compared to a tournament week. So there's obvious differences there. And that's the challenge with tennis. There's so much variability in week-to-week training that you have to train well enough that an athlete can handle an unusual situation that may come up. So here we see we have the initial training status, and we categorize these as underprepared, meaning athletes that are coming from a significant break. This could even be post-injury. They've maintained some level of fitness, and then well-prepared, meaning that they haven't really missed anything, and they're just going straight into a full training week. And this is examples of how to break up the weeks, how to put criteria around them, and then estimated weeks to reach their goal. And this is defined by, trying to be ready for high-level competition again. So if an athlete's underprepared, it takes a good 7 weeks to get them fully ready to play at a really high level. If they've maintained mostly, it's probably less than 6. If they're well-prepared, it's only a few weeks. And this is really important, coming back from injury, coming back from long breaks, making sure that the athlete has the ability to do what they're being asked to do and not bring him back too early. Here you can see just a visual representation of how this would map out over their weeks until competition. And an underprepared athlete would use a 3-week increase. Week 4 would be a slight download, and then 3 weeks up into competition. The maintained athlete, similar protocol, and then the well-prepared athlete is just 3 weeks in a row with increasing, total workload. So here would be some of what it would look like from this perspective. If you break it down week by week, total hours per week, what the average RPE is going to be, how many sessions. This includes The tennis sessions are on court. The non-tennis, that's warm-ups, cool-downs, stretching, mobility, strength, power, speed, all those sessions. So that's why you have a higher number of total sessions of non-tennis than tennis. So again, going through this, understanding that many of you may not go into this much detail, you may not see your athletes as consistently, but having an awareness, just like you do a post-op, a timeline, a return to high-level competitive tennis, you should also have a similar progression and plan as you would from a post-op or post-injury scenario. So, talked about a lot there. I know there's probably a lot more questions than answers here. Tennis is challenging. There's a lot of variables. So please email me and I can get you more details on any of this stuff. Feel free to reach out. Happy to help any way I can. Just want to thank the Cleveland Clinic for hosting this event and really excited to learn from everyone else as well with some of the other talks during the summit.